Thornton, CEO of Chronic Pain Rescue. We are just really thrilled today that we're going to have a live interview with Dr. Carolina Sueldo. She is double boarded in OBGYN, as well as reproductive endocrinology and infertility medicine. Just an honor to have her here with us today. If you could just say a few words about yourself and what you do to help people.
Sure. Dr. Ruth, first and foremost, thank you so much for having me on. Hopefully you guys can hear me okay. Sometimes with the headphones, it's a little hit or miss. But yeah, as you mentioned, I am double board certified. I have been practicing now for almost a decade. I really love what I do. I'm passionate about empowering women with regard to their bodies and their fertility and knowing their options. So I'm really passionate about that. I've been fortunate enough to speak both nationally here at our local meetings as well as internationally throughout South America. I've held several positions within the women's healthcare space, and I'm just a women's healthcare advocate, I think is my number one thing I would love your audience to know.
Okay, awesome. I'm not seeing your face very well though. It's freezing. I'm gonna see if there's something I can make better. Just give me a second.
Okay.
Okay, we'll see if that does anything. So actually, that's great. I think many times women's health is neglected despite the fact that there are so many, things available. So I think this is good. I think, we're ripping and running and doing so many things that so many times we're not taking care of ourselves. So I think it's awesome what you do. I did want to ask you to address specifically a couple of concerns I know that can happen with women, pain, pelvic pain, and what are the causes of that? How would people find out the reasons they may have pelvic pain, and then also I have seen some questions with some people on the internet asking what to do about pain during pregnancy. Sure. Perhaps it's back pain or just the discomfort of being pregnant.
Sure.
You could address. Sure.
Yeah, absolutely. So the first thing I'll say, I wholeheartedly agree with you. I think as women, we are socialized to take care of everybody else, and our own health sort of gets put down at the bottom of the barrel. And I think particularly in this post-COVID world, what we see is a delay to care. So we're actually seeing increase, women who are not coming in for their pap smears, women who are not coming in for their mammograms. And that's obviously going to delay diagnosis. So I think it's super important, to just be checking in once a year with your healthcare provider, whether that's a PCP, primary care provider, or with an OBGYN. You want to be seeing somebody at least once a year, making sure that all your annual health maintenance is up to date. So I just wanted to sort of, second you in terms of what you were saying with that. Now, specifically with regards to pelvic pain. So let's shift gears. Let's talk a little bit about that. The first thing to understand is that there are many different structures within the pelvis. We have bones, we have muscles, we have our intestines, we have our bladder, and then we have the female reproductive system. And so for me, as a fertility specialist, I'm really focused on that female reproductive system. Is there something going on within the uterus? Is there something going on within the ovaries? Or is there something going on within the pelvis that is potentially impacting and causing that woman to have pain? We know that, for example, fibroids, which are basically muscle growths on the uterus, when they reach a determined size and location, they can be a cause for pelvic pain or pelvic pressure in a chronic sense. Fibroids are easily diagnosed usually by a vaginal ultrasound or a pelvic ultrasound that is looking at the uterus, because you'll see that ball or muscle growth. Another common thing that I encounter, particularly as a fertility specialist, is something called endometriosis. And endometriosis is essentially where the lining of the uterus, what we shed every month with our period, a portion of that backflows through the fallopian tubes and implants in the pelvis. And so we see those implants bleed when the patient bleeds. They are inflammatory in the same way that our period is inflammatory. And so they can be a cause for progressively worsening pelvic pain, painful periods, and then when patients come to see me, many times because they present with infertility. So it is really important to discern what could potentially be going on. And then you talk about the ovaries. We know that ovarian cysts, particularly the larger in size they can also be a cause for pelvic pain or pelvic discomfort. A cyst can become an emergency if it twists on itself. So we know that the ovary is like a bean on a stalk. The blood supply feeds through that stalk. And so if the ovary twists on itself, it can cut off its own blood supply. It can be extremely painful. The other thing we know is when a cyst ruptures, that fluid that is released into the pelvis can sometimes cause that pelvic pain or discomfort. So a ruptured ovarian cyst. So those would be some of the more common sort of GYN or gynecologic pathologies that may cause pelvic pain. Now, there are others. So, for example, if a woman has a pelvic infection in the acute stage, if it's severe, that can sometimes cause pelvic pain. If that infection spreads and it causes an abscess, which is basically a ball of pus in the pelvis, that can also cause pelvic pain. Women who have had surgery or previous surgeries may develop scar tissue. And I think about scar tissue like sticky bubble gum on a sidewalk. When you step on it and you lift, the whole piece of gum comes with you. And so that scar tissue can distort the pelvic structures and could potentially be a cause of pinched nerves or pelvic pain within the pelvis.
Oh, your volume went down. I don't know what happened.
Oh, sorry. Can you hear me better now?
Yeah, I hear you now. Okay.
Oh, okay, perfect. So yeah, so you know, I try to touch upon sort of the 4 or 5 most common things. There are many other causes of pelvic pain in a female patient, but when it comes to sort of the GYN or the pelvic female structures, those are going to be some of the things that we're focusing on.
Okay. Okay. Very good. Very good. And the pelvic inflammatory disease you mentioned, that's really an acute thing. So they would have, it wouldn't be something if they have long-standing pelvic pain. That's probably not it. Would that be correct? Okay.
Right. So pelvic inflammatory disease, it typically presents in the acute stage, and it generally is not just pain. So generally they'll present with low-grade fevers, chills. Right. They may have foul-smelling vaginal discharge. So there are other symptoms that do accompany it.
Now, there are different treatments for fibroids. I remember that. So what are some of the ways that people, if that's a cause of their pain, some of the things they can have done or do to alleviate that?
Yeah, so specifically with fibroids, and I think broadly this is going to be true for any gynecologic or female reproductive condition. We typically tend to divide the treatments out both in medical management and surgical management. And I'm sure in your practice, you also talk to patients about lifestyle and supplements. I'm not going to emphasize too much on that today, but really focusing on the medical treatment and the surgical treatment. When you talk about surgery, there are different interventions from least invasive to most invasive. The most invasive would be a hysterectomy or removal of the complete uterus. And this typically occurs in a patient who has completed her family and in a patient who has failed medical management or less invasive therapy. If you don't want to remove your uterus, let's say you have not completed your family, you still want to have more children, then another surgical option would be a myomectomy, which is the removal of the fibroid itself. However, this can also be quite invasive depending on the number and size of the fibroids the patient has. There are less aggressive treatment options. They're called embolization or ultrasound-guided ablation. And those are where we're basically targeting the fibroid itself in a very minimally invasive way. The issue with those two options for women who have not completed their family building is that we don't have good data on is there an impact to the uterus after that procedure to then hold a pregnancy, to avoid preterm labor, to avoid placental issues. So the data is still limited with regards to those two options, but those would be the two least invasive surgical options of the four. Now, shifting gears, most people would first start with medical management of the fibroids. Medical management could be something as simple as birth control pills or progesterone-only medication. It could be more aggressive, looking specifically at GnRH analogs. And the way I think about GnRH analogs for those who are non-medical is that they basically put the body into a medical menopause. It is medically induced. It is reversible. It is based on the medication that you're taking. And so the idea is that fibroids feed off of estrogen. And so with every menstrual cycle that we have and every ovulation that we have, we're making estrogen. So if we can turn off estrogen production, then we are hopefully suppressing or starving that fibroid of the stimulus it needs to grow. And as a consequence or byproduct of that, we're shrinking it. So medical management is really focused on trying to suppress growth, not so much to shrink or eliminate the fibroid itself.
Okay. Where does something like Lupron fit with what you're talking about? Is that
yep? So Lupron would be in the GnRH analog family, correct?
I see. Okay.
And there are some newer medications, Orion, Myfembry. Those are both oral medications. They're taken in daily fashion. The nice thing about oral daily medications is if the patient does have unwanted side effects, you can kind of turn it off pretty quickly. Lupron is either a 1-month injection or 3-month injection. Those are both new, I would say, in the last 3 to 4 years. And we are seeing very good results with them. So that could be, again, all of those, Lupron, Orion, Myfembry, they all fall into the family of GnRH analogs.
Okay, very good. I was just wondering, and this is a deviation because I know I said I just wanted to talk with you about pelvic pain, but I have heard of this. I don't know whether you're familiar with it, so just to put it out there. Someone having generalized pain that took, they have those, they're estrogen-like, they're plant-based, I think, estrogens. I'm probably saying it very wrong, but they would have the hormones, they're similar female hormones, but they're not, I guess they're not from a human source. And with that, even though they were trying to maybe work on their energy level or whatever, they found that they had less pain. I don't know if you probably could say it better than I'm saying it.
Yeah, that's okay. So I think what you're alluding to is bioidentical hormones.
Yes.
I think that's what you're talking about is bioidenticals. And, I'm less familiar with them in the setting of pain. I'm more familiar with them in the setting of energy, menopausal symptoms, things like that. And my feeling on that is we just don't have the data yet to back it up. Typically, those bioidentical hormones are not FDA approved. And so you really don't know how much you're getting in each administration. So I typically recommend patients, and especially when you're dealing with hormones, you don't really know what that imbalance could be causing in your body. I strongly recommend that you work with an OBGYN or a fertility specialist like myself to really identify, okay, what is the issue and how can that issue be treated safely and you know, evidence-based practice medicine. Right now, bioidenticals are there's just not, we don't know enough yet to be able to make solid recommendations.
I see. Okay. Okay. Very good. Very good. And before I did ask about pain with pregnancy. I know some people have low back pain. You don't want to take medication, period. You're pregnant, you know, or even maybe just having the pain from having this kind of excess area in their abdomen, and that could be, the weight of that can cause pain. What do you recommend? What are some things women can do when they're in that state?
Sure. So the number one thing I would say is you definitely want to stay from the family of NSAIDs. So that will typically include anything like ibuprofen, Midol, Aleve, naproxen. You really want to shy away from those because they can impact baby's heart. So generally we talk about Tylenol as the only safe studied medication in pregnancy for pain. Now, there are scenarios where there's acute pain, there's, you know, severe chronic pain, et cetera, and narcotics may be indicated in those situations. The important thing patients need to be counseled about is that if they are on those medications long term, that there could be withdrawal effects to baby upon delivery. And so those babies typically require a little bit of hospital stay, whether it's in the NICU or not, to monitor those withdrawal symptoms. Now, I think for what you're describing, so those are kind of the more extreme cases. I think for what you're describing, which is the generalized discomfort of pregnancy, I do think there's a lot of things that we can do from a musculoskeletal or physical therapy standpoint, doing exercises with a physical therapist trained in pregnancy, trained in pelvic floor disorders. There's, you know, when I was pregnant, I had significant low back pain and they had me use a belt, but it wasn't just a general pregnancy belt. It was specific to my lumbar and sciatic area. And so really working with someone who is knowledgeable in pregnancy can really help to decrease a lot of that. For those who are interested in integrative practices or complementary medicine, exploring something like acupuncture can be very worthwhile. You know, obviously it needs to be somebody who is familiar with treating pain in pregnancy. But that would definitely be another option.
Okay. Yeah, they do have to be careful with that. I think that there's certain points that they can't go to because it could induce labor. So I know that about acupuncture, but is massage therapy a safe thing to do?
So I would say same with acupuncture. We know that there are certain massages that are not safe in pregnancy. And so you can absolutely get a massage in pregnancy, but it needs to be somebody who knows what they're doing. It needs to be somebody who's trained to work with pregnant women.
Okay. Very good. All right. Well, I'm not sure if we have other questions. You know, if people want to reach you, you work out of an office or out of the hospital, those types of settings, right? Someone will have to see you in person if they're going to see you. Am I correct?
Correct. So I am currently licensed in the state of California and in the state of Florida. I currently practice in Central California at Women's Specialty and Fertility Center. So if anyone has questions after today's live, I am across all social channels, Instagram and Facebook. They can send me a direct message. I would love to hear what they thought of the live, if they found it useful. For those who are looking for information specific to fertility and all reproductive things, I do have a YouTube channel. All of these accounts are just my name, Dr. Carolina Sueldo. And on that YouTube channel, I do have weekly episodes that are about 10 minutes long, just sharing information with regards to women's reproductive health.
Okay, awesome. Very good. Thank you so much for it's been very informative, this session with you. Hopefully we can do this again.
Thank you so much. Yes, I would love that. Okay. Thank you so much for having me on.
All right, great. Thanks again. Peace and blessings. Okay. end.